Hello everyone, welcome to another video. So in today's video we'll be looking at acute bacterial meningitis. So looking at the overview of this condition, acute bacterial meningitis is a life-threatening infection of the meninges. And what are these meninges? The meninges are the protective membranes covering the brain and the spinal cord. And this bacterial meningitis, it causes inflammation, swelling, and increased pressure in the skull, which can damage the brain and the nerves. So it is a medical emergency actually, and it requires urgent diagnosis, urgent treatment, and the use of intravenous antibiotics accompanied with supportive care. And if this acute bacterial meningitis is not treated quickly, it can lead to conditions like seizures, brain damage, hearing loss, and even death. So let's look at the anatomy of the brain, or the CNS. So the central nervous system consists basically of the brain and the spinal cord, and both of them are protected by, number one, the skull and the vertebrae, number two, the cerebrospinal fluid, which is a clear fluid that cushions and nourishes the brain and the spinal cord, and is also protected by the meninges. The meninges consist of three layers. Number one, the dura mater, which is the outermost layer. Number two, the arachnoid mater, which is the middle layer. And number three, the pia mater, which is the innermost layer. So when the bacteria invades the cerebrospinal fluid, they multiply and trigger an inflammatory response in the meninges, and this leads to swelling and increased pressure in the brain. So for the pathophysiology, basically the bacteria usually enters the body through the nose, the throat, the ears, or the bloodstream, and it reaches the meninges. So the body basically reacts with number one, the inflammatory response. So the immune cells, they release chemicals that increase permeability of the blood vessels, causing swelling. Then the body also reacts with increase of intracranial pressure, that is, which can reduce the blood flow to the brain. Then there's also neuronal damage due to toxins released by the bacteria and due to the inflammation too. So common bacteria that cause meningitis, we have Streptococcus pneumoniae, Neisseria meningitidis, Haemophilus influenza, and Listeria monocytogenes, which is common in older adults or people with weak immune systems. So for the causes of this acute bacterial meningitis, bacterial infection is the main cause, which spreads from sinus infections, ear infections, respiratory tract infections, bloodstream infections, head injuries, or from neurosurgery. And another cause could be immunosuppression, maybe due to the patient having other conditions like diabetes, HIV, or cancer, and also some congenital defects in the skull or in the spine. So for the signs and symptoms that are seen in this condition, typical symptoms develop rapidly over hours or a few days. And the symptoms that we can see in in adults and older children, there will be sudden high fever, severe headache, neck stiffness, sensitivity to light, which is known as photophobia, nausea or vomiting, confusion or like having an altered mental state, seizures, sleepiness or difficulty waking up, cold hands and feet, pale or mottled skin. This is seen in severe cases. Then in babies and young children, we see symptoms like bulging soft spot on the head, poor feeding, irritability or constant crying, lethargy or floppiness, and there can be seizures too. So for the differential diagnosis, other conditions that could show the same symptoms that we see in acute bacterial meningitis, for example, viral meningitis, which is usually milder and often comes without severe complications. Then we have encephalitis, which is the inflammation of the brain tissue itself, often comes with more confusion and seizures. Then there's also brain abscess, which is a localized collection of pus in the brain. Then there's also migraine, which can mimic the severe headache that is seen in bacterial meningitis. Then There's also subarachnoid hemorrhage, which is basically bleeding in the brain. And also, if someone has severe flu, it can present similarity, but there's usually no neck stiffness in this case or other neurological signs. So for the diagnosis of this condition, number one, medical history and physical exam is done. So the doctor will check for signs of meningeal irritation like neck stiffness and other signs. And then another test that can be done is lumbar puncture, spinal tap. So a sample of the person's cerebrospinal fluid is taken and is analyzed for the appearance, and it's usually cloudy if the person has bacterial meningitis. Then also they check for the white blood cell count that is high because an ongoing inflammation is happening. Then the glucose level is usually low, protein level is usually high, and then culture test and sensitivity test is done to identify the bacteria and know which exact antibiotic that the bacteria is susceptible to. So blood tests are also done, like complete blood counts and also blood cultures. Then imaging like CT scans or MRIs, they are used to know if there's risk of brain herniation or before the lumbar puncture is done in some patients. So for the treatment, immediate hospitalization is required in this set of patients because it's an emergency, and they are usually given intravenous antibiotics based on like the likely organisms that are causing the bacterial meningitis, which are usually adjusted after getting the culture and sensitivity results. So the common antibiotics that are given, for example, ceftriaxone, cefotaxime, and vancomycin. So these are all strong antibiotics that are given in very severe cases. And they also add ampicillin for older adults or for immunocompromised patients. Then corticosteroids too are given, like dexamethasone, which is given to reduce the inflammation and prevent hearing loss, especially in cases that are caused by streptococcus pneumonia. Then supportive care like giving oxygen, fluids, fever management, seizure control. So all these medications that can help in other cases. And also isolation may be required to prevent the spread of this infection, especially if the patient has meningococcal meningitis. So for the management and prevention, early diagnosis and treatment is essential to reduce complications, and vaccination is key. There is the pneumococcal vaccine, the meningococcal vaccine, the Haemophilus influenza B type B vaccine available, and chemoprophylaxis, that is preventive antibiotics, they are given for close contact cases of meningococcal meningitis, and the antibiotics that are given in this case is rifampicin. Then it's also good to monitor for long-term complications in these patients like hearing loss, learning disabilities, behavioral issues, or some seizure disorders. So in summary, acute bacterial meningitis is a dangerous, life-threatening infection of the membranes around the brain and spinal cord, known as the meninges, and it causes rapid onset of fever, headache, neck stiffness, and confusion. And it is most often caused by the bacteria like streptococcus pneumonia, Neisseria meningitidis, and it must be treated urgently with intravenous antibiotics based on culture test and sensitivity test, and supportive care like giving oxygen, giving medications that can help with seizures. They should be given together with the antibiotics. So that is basically the summary of this topic. So I'll see you in the next video. Thank you for watching, and I hope you learned a thing or two. Bye.